Experts have raised concerns about the prevailing vaccination hesitancy in the country as it could impact the vaccine rollout strategy. Just over 9 million people have been inoculated so far, with government targeting to vaccinate 67% of the population by the end of the year. We're now joined by Professor Barry Schoub, chair of the Ministerial Advisory Committee on COVID-19 vaccines. Professor Barry, good morning. Good to speak to you as always. Let's unpack what vaccine hesitancy actually is.
Yeah, this is becoming an increasingly worrying issue. We don't really know the precise figure, but certainly the kind of the vaccine reach has dropped quite worryingly. We were up to about 260,000 a few weeks ago. We're now down to about 153,000. So that's an over 40% drop over a few weeks, and certainly way below what we're trying to get to, which is 300,000 by the end of the month. So we're really midway through August. We've got quite a lot of catching up to do. And I think there are various reasons why we've got this lull in vaccination. We can maybe go through it just now.
Well, I suppose we could go through it right now, actually. It's
right,
ironic, though, don't you think, Professor, that we had gained so much momentum and the expectation that as more and more people get vaccinated, then the word spreads on it's safe, go ahead and do it, I've done it. But the contra has actually occurred.
I think there are many reasons. I think there are a multitude of reasons. On the one extreme, we have the anti-vaccination lobbying group. I think they're a relatively small group. I know there was a recent HSRC survey, and they probably, the number of people who refuse to get vaccinated is probably saying about 10-15%, saying like that. That's a relatively small number. By far the larger number are the vaccine hesitant people. I think we need to distinguish between vaccine hesitancy and anti-vaccination lobbying. The anti-vaccination activism is a difficult one to kind of overcome. But the hesitancy is really where we need to focus our attention. And I think there are a number of reasons why people are hesitant to get vaccine. Some of them are scared of the side effects. Some of them don't like being inoculated. Some of them feel that the vaccine has been developed too fast and that maybe safety concerns, those corners have been cut. I think these are, and then of course we have, I think, a fairly substantial number of people who either it's a problem to get to a vaccination site because they stay at fairly remote areas, or alternatively just simply apathy. The feeling is, well, look, the epidemic's come down. Is it necessary really to get a vaccine? And I think this is really where we need to concentrate our communication efforts to try and get people to understand, first of all, that the vaccine is safe and it's effective and it's necessary. And I think these are the messages we have to get across to the population at all kind of sections of the population.
Well, in the papers today, you talk about communication and what messages we need to send across, but the Department of Health is quoted as saying they don't have a budget to send out any communication. Now, does that leave us in a bit of a quandary?
Yeah, Hugo, I saw that as well, and it's really worrying. I think a budget should have been set aside for communication. I think communication is vital. This is the first time we've really had a rollout, or say a universal rollout in the adult population. We've been used to having rollouts in the pediatric and children, but never in adults. So it's new, it's novel. And I think we need to be prepared to get that message across. It's got to be language adapted, it's got to be culturally adapted, it's got to be appropriate to the circumstances. The urbanized, more sophisticated population through electronic media, the more rural population through loudspeakers and leaflets, and people going out directly to the population and communicating this message that which I just said now, that vaccines are safe, effective, and they are necessary.
Professor, you've pretty much summed up what's been happening in Limpopo, where that is one of the areas that has achieved the highest success numbers when it comes to vaccination. Right. Is this message filtering through? Is it being spread to the rest of the country?
I think probably not. And what's interesting, actually, I've got a figure over here that there's a fairly recent, it was an online survey done by HSRC, and they actually found that the level of education is inversely related to vaccine acceptancy. They kind of found that people, 72% of those who had an education below matric level were willing to get vaccinated, as against 59% who had tertiary education. So, I think that the messages have to be appropriate. And I think that, unfortunately, there's stiff competition from social media. And social media is a two-edged sword. It's got a very positive aspect to it and an equally negative. And some of the kind of anti-vaxxer problem, the anti-vaxxer conspiracy theories and negative messages are also going via social media. So we need to use social media in that section of the population more receptive to it for a positive message.
Now, a few minutes ago, we watched an interview that Mia Milan had on the Health Hub, a new segment that we have on the show, and she was in conversation with Dr. Anthony Fauci. And one of the things that he raised was what he called trusted messengers. And these are individuals that go into communities trusted by members of those communities to allay any fears and guarantee or encourage certainly a huge amount of vaccination. Now, when we heard a few weeks ago from the Health MEC for Limpopo, one of the things that she spoke of was the fact that they're using the same trusted messengers. So surely there is no real need for us to reinvent the wheel. It might be a little bit of a challenge in the cities, but how are we adapting that which is successful in parts of South Africa to the rest of the country?
Yeah, look, I think that's a very important way to go, to look at trusted messengers. We can either look at religious leaders, we can look at traditional healers. I think we need to look at the people, as you say, the trusted messengers. It's all very well for people like myself giving scientific views. It's all very well for, opinion leaders at a high level. Unfortunately, they're not always listened to, and they're equally balanced by the kind of contrary messages. But as you say, the trusted leaders, the people that the community look up to and trust, as the name implies, are really who should be kind of harnessed to kind of deliver those messages most effectively.
Is vaccine hesitancy fluid? Do some people start off unwilling, sit on the fence, and then at some point become vaccinated or agree to get vaccinated? And if so, what are the factors that push them to getting vaccinated?
Yeah, I think this is quite an important group. It's a group who we call the kind of nervous group. They kind of think, they should get vaccinated, but they're a little bit kind of worried and they kind of draw back. I think once they see that their relatives, that their neighbors, that their friends have been vaccinated, and that the side effects of the vaccine are not too bad or not at all. Many people don't have any side effects at all, and the great majority who do have will be very mild. And I think once they see that, they might well be persuaded to be vaccinated. And I think this is an important point, particularly for the gap in vaccination in the older group. And I think this is also why we're seeing that at least 50% of the 60 plus, which is obviously the key age group, are not being vaccinated. And I think now that it's being lowered to a much lower age group, we should try and encourage the younger people to take their parents or their grandparents along to see that getting the vaccine is not as bad as they kind of fear that it would be.
So we've been reading recently that men, I think above 50, are particularly reluctant to get vaccinated. Can you tell us why?
Yeah, I wish I knew the answer to that. But it is, I think it's 60%, 60-40 for female-male ratio. And I think it's I can't understand that. Is there maybe a greater nervousness or insecurity amongst men to get vaccinated? Maybe women, because they've had children and so on, they have the kind of experience of being in contact with the healthcare to a greater extent. Look, I think we can speculate, but I think it's unusual. I haven't heard of it elsewhere in the world, I must say.
Now, Professor, finally, you are chair of the Ministerial Advisory Committee. Yeah. What advice are you giving to the minister regarding hesitancy? Because obviously it is a big problem for us.
Well, we do have a group which, in fact, it's not only our MAC, it's also the MAC on COVID-19 and the socio-behavioral COVID MAC. And the three MACs have actually got together to form a working group, which is looking specifically at vaccine hesitancy and to kind of give the message to the minister, some advice on how to address it. Because I think it does cut across all the three ministerial advisory committees. It's a complex issue, but it's an urgent issue. We really need to look at it now because this is really going to impact on our vaccine reach.
Professor Barry Schoub, lovely speaking to you this morning. Professor Barry Schoub is chair of the Ministerial Advisory Committee on COVID-19 vaccines. And that conversation that we were having this morning certainly is about the level of hesitancy and how it's slowing down the COVID rollout program.